The smoke-free policy affords healthier living conditions because it bans smoking or tobacco use, which is the most preventable cause of disease, disability, and death in the U.S. In addition, secondhand smoke is a public health risk, and there is no safe level of exposure. A smoke-free policy can also provide safer housing, given that smoking is the leading cause of residential fires and the #1 cause of fire deaths in the United States. Prohibiting smoking indoors reduces operating costs such as unit turnover, cleaning and repair, fire damage costs, and insurance premiums. It truly has become a legal liability for public and private landlords not to have a smoke-free policy in place. When Stephen assigned me to be the project coordinator for the PHA smoke-free policy, he handed me a newspaper article with a picture of a disgruntled public housing resident from another city, fist in the air. They were unhappy about the smoke-free policy. My first inclination was to run and to run fast. The beginnings of social change are not always embraced. Typically there is opposition. But this challenge presented itself to be instrumental in upholding the PHA's mission to provide clean, decent, and safe housing in modern terms. To be successful in executing a smoke-free policy in a large public housing authority such as ours, the following elements are required. A team approach, supportive partnerships as we have in the Tobacco-Free Providence campaign, free smoking cessation opportunities for residents through the Providence Community Health Center, education and outreach to residents about potential health risks involved, and most importantly, positive messages. Our positive messages are clear. The Providence Housing Authority did not want to take away the right to smoke, but rather empower public housing residents with the right to breathe clean air. Instead of enforcing a policy, the PHA put into motion healthier living environments for our residents. Although I expected otherwise, a survey was conducted and showed that 83% of the respondents supported a smoke-free policy. In addition, almost 1/3 of them smoked regularly, and of those, 62% wanted to quit. Offering smoke-free smoking cessation services to the residents, their families, and the PHA staff, no matter their health coverage, sets us apart from other smoke-free public housing authorities. Our program includes one-on-one, on-site counseling sessions and provides free nicotine replacement products such as nicotine patches, gums, and lozenges. I was particularly happy when we were able to begin our smoking cessation sessions before the smoke-free policy was implemented. I believe it sent another message. The PHA is there to help. To date, 43 PHA residents have sought smoking cessation assistance. As part of the PHA smoke-free work plan, a smoke-free task force was created that met monthly throughout the policy's research, design, and implementation process. PHA Legal Counsel did extensive investigation in relevant liabilities, cases, and past approaches. Approximately 10 months before the policy's implementation, widespread communication began with the residents in various forums, which built resident support and anticipation of this policy. Bilingual letters outlining the smoke-free policy reached over 1,000 residents. 347 pre-policy survey takers attended informational meetings. Table discussions and focus groups about the risks of smoking and secondhand smoke were conducted. Smoking cessation slideshows were presented and bilingual materials were consistently posted in all 5 buildings. Today there are more than 240 public housing authorities nationwide who have implemented a smoke-free policy. This is a major achievement in public health success, which will help ensure that more families have access to safe and healthy public housing. Smoke-free housing is the wave of the future. This is a proud moment for me, for the PHA, and for the Tobacco-Free Providence campaign in the fight against tobacco, because we are able to see a small piece of social change happening before us. There are residents and staff here supporting us here who struggle with their tobacco addictions that now have the resources and motivation to quit. We wish you luck in your fight against tobacco, and thank you for highlighting the importance of this policy.